We have a GMA health alert for the many Americans who deal with digestive discomfort on a regular basis. With Crohn's and Colitis Awareness Week underway, now's a good time to ask, when is stomach pain just something you ate, or could it be a sign of something more serious? So to answer those questions and more, we have Chief Medical Correspondent Dr. Narula in the building. Great to see you, Doctor. Thank you, as always, for being with us. So we've all experienced gas, stomach aches, bloating, all the rest. What is the line of demarcation from when something is just a normal stomach issue to when you should go see a doctor?
Yeah, I mean, a lot of this is common sense. So certainly if it's something that's mild, it kind of comes and goes, you know your trigger, like I ate really spicy food and now I feel heartburn, probably not an issue. But if it's something where it's more persistent, it's more severe in terms of the pain, it's really affecting your quality of life, or you're having other symptoms like persistent nausea or vomiting or loose stools, at that point you may want to say, I should really get this checked out, and that may be with your primary care, a gastroenterologist, or even in the emergency room. And then one last point I want to make is a lot of times people feel discomfort up here, which is actually chest pain, cardiac pain, and they think, oh, it's just acid reflux, and they kind of blame it on that, and they pop Tums and take antacids. So anytime you feel anything up in this area, don't just blame it on, gastrointestinal, definitely get it checked out.
And I know this week is Crohn's and Colitis Awareness Week, and so let's talk about some of those conditions. What exactly are they, and then what are some of the early signs of these?
Yeah,
diseases?
Ginger, so ulcerative colitis and Crohn's fall under this umbrella of inflammatory bowel disease, which is different from irritable bowel syndrome, which a lot of people confuse. Inflammatory bowel disease means you have actual inflammation of the lining of your digestive tract. If we're talking about Crohn's, it's anywhere from essentially the mouth all the way down to the rectum. If we're talking about ulcerative colitis, it's just involving the colon. Tends to happen in people early, like 15 to 30 years old. It can run in families, so there may be a genetic component plus an environmental component. Some people have it more mild, some people have more severe, and it's characterized by these periods where you have flares and then you kind of go into remission. And the symptoms can be abdominal pain and cramping, again, diarrhea. You may see blood in your stool, which can be a concerning sign. And then some people can have fever, fatigue, weight loss, and even symptoms outside the gastrointestinal tract involving their eyes or rashes, skin rashes, or even joint pain.
You only find it by endoscopy or colonoscopy?
So they do blood tests, they do stool tests, and then also imaging, endoscopies, colonoscopies. That's how it's diagnosed. And then unfortunately there can be complications around it with bowel obstructions, and people will tend to get early colonoscopies because they may be at higher risk for colon cancer.
Doctor, a lot of people will try and manage their stomach pains, their stomach issues on their own with diet changes and over-the-counter medications. I am guilty of that. But what can actually help or make things worse?
Yeah, in some cases it's totally reasonable to take things like Pepcid, antacid, those kinds of drugs if you know this is my typical symptom. But lifestyle can be a huge way to deal with gastrointestinal issues. So for example, increasing fiber in your diet, eating a lot of whole foods instead of the processed foods, avoiding carbonated beverages or kind of sugary meals or greasy meals. Exercise, managing stress and sleep and hydration, that can all be really helpful. And then certainly talking to your doctor about what you might be doing, what you could be doing differently. And last, I will say sometimes medications can actually cause you to have abdominal discomfort. So you want to go through your med list and make sure you're not taking something that might be causing that as well.
Great advice, Doctor. Thank you so much, as always.